Now let's get into MDFT, kind of the details, the nuts and bolts. And we work in 4 domains. We talk about 4 domains, excuse me, and 3 stages. And the domains of work are adolescent, parent, family, and community. And they're all related. In those 4 domains, we have general goals for each domain. Now, MDFT is very individualized to the youth and the family and the parent situation. That's one of its strengths. But in general, there are certain goals that you almost always have to address in most families. And these are them. So in the adolescent domain, we're going to work to improve self-awareness and enhance self-worth, help the youth develop meaningful goals, life goals, short-term and long-term. Often we have to help the youth improve their emotion regulation, coping and problem-solving skills, and communication skills. In the parent domain, typically we have to strengthen parental teamwork, help the parents improve their parenting skills and practices so they are more effective, rebuild parent and teen emotional bonds, which may have been frayed from their experiences, and also spend some time in enhancing parents' individual functioning. Parent has to be in somewhat decent shape, physical, emotional, in order to parent appropriately for their children. So we also focus on if there's a need there, parental mental health problems, physical health problems, substance abuse, try to address that as well. And then in the family domain, that's parents and children together, we work to improve family communication and problem-solving skills so people can talk in a direct and clear manner in a way that others can hear them. We help people listen and understand. We strengthen emotional attachments and bonds and feelings of love among family members and improve everyday functioning of the family unit. And then the 4th domain is the community, neighborhood, perhaps. And we improve family members' relationships with important social systems such as school, court, legal, workplace, community, and build their capacity to access for themselves and advocate for themselves. Now, not every family needs everything, and again, it's very individualized, but this is in general where we're going to go in MDFT. And I'll talk more about that. And so I said the domains, adolescent, parents, family, community, are worked simultaneously in 3 stages, 1, 2, 3. Stage 1 is relatively short, and we focus on the foundation of therapy, and that's developing therapeutic alliances with the teen and the parents, other family members, and school personnel, court, probation officers if they're so involved. Stage 2 is the largest hunk of MDFT, and that's where we work the themes and request the behavioral change. So that's where most of the action is. And then stage 3 is the end. Usually we start working in that way the last 4 to 6 weeks of anticipated discharge, and that's where we're going to reinforce those changes and prepare for exit or termination. So always the MDFT therapist is thinking in terms of domains and stages. And now we're going to play another video, and this is from Dr. Cindy Rowe, who's a professor at the University of Miami and also a national MDFT, a sense of her view on what MDFT is.
I think it just covers so many bases. It's so comprehensive, and it's sort of really got most everything in it. It's got a lot of the behavioral and cognitive interventions that you would find in a CBT approach. It's obviously doing a lot of parenting work, parent management things that are incorporated, and family work, which again, basically all empirical standards now that are well thought out and well articulated are going to say you must involve family, and it has an ecological approach. So it's really got everything in it, and it brings everything together in a kind of step-by-step way.
Pardon me, doctor. I think the double audio is affecting several of our attendees, and I think what I'd like to do is transfer the power back to you and have you play the video and see if that works better. Here we go.
And what do I do? Just click on it?
Yeah, if you will, do you have the arrow and the progress bar?
Not the arrow. Yeah, that's my problem.
Gosh, I'm sorry. I don't understand why it's doing this. Although I see people say I can hear well now, much better. So let me go back to what we did before, and let me apologize for the echo to those who are experiencing it.
Deep and lasting change. It's such deep work. It's such real, deep, meaningful, lasting work that it's like, why would you do anything else? It just covers all the bases. It goes after every possible factor that we can go after. And so other models where it might be just parent training, or it might be just a CBT, or might just get peers together or do whatever it's doing. And I always say in that first day of training is if we know all of these factors are involved, and that it's many factors working together against this kid to take him off the track. And if we know that, why wouldn't we go after every possible factor to just have the best possible chance for this kid? And I don't know of another treatment that's so comprehensive to actually see a family come together and basically overcome like great hurt and great challenges and disadvantage and overcome that, come together and start to deal with things that are very difficult and for the good of this kid, for the benefit of this kid. There's nothing like it, and you can't put a dollar figure on it for your economic evaluation. You can't. It's almost something you can't put into words, but it's unbelievable. But what happens in MDFT, where the whole environment, the whole system of this child's life changes. It's amazing. And these 13, 14, 15-year-olds, they're children. Their whole lives are ahead of them, and that's what MDFT does, is transform the entire child's life. And there's nothing like that.
Okay, and one moment. And while we're getting started again, I think it might help if you try muting your phone. I have heard that from several participants. So next time we have a video, try muting your phone. Thank you very much, and sorry about the interruption.
Okay, let's continue, a little sense of it. Now we talk about stages and domains. So we'll start at stage 1, of course, and I'm going to talk a little bit about all domains because we do similar work to develop alliance and motivation with the youth and the family, parents, but also we do special things with each because they're at a different developmental level. So let's talk first about stage 1, all domains. So I want you all to think a bit about what's the single most important goal of a first session. You have a first session, and I want you to think a bit about what's the most important goal. And we'll take a couple minutes. You could write some of your answers on the Q&A, or if you don't want to do that, just think for yourself. And think very simply. And basically, the most important is to have a second session, right? If there's no second session, then you're lost. And in MDFT, we're always thinking, part of what we do is help therapists think in a different way like an MDFT and learn how to make clinical decisions in the moment so that they're going to achieve their session goals. So since a goal of session 1 or initial engagement is to have a second session or a third session, what the MDFT therapist needs to ask themselves is, what do I want the teens and parents to be saying to themselves after this first session to make it more likely that there will be a second session? And those are the things that I'm going to say and do and focus on. So I want you again to think for a moment of what are kind of the things that any therapist would want the teens and parents to be saying to themselves or each other as they leave that session. And that's our focus. I'm just trying to give you a sense of how the MDFT therapist operates. And so there are, I think we would all agree, we want people to be thinking or saying things like this. I think she, the therapist, understands me. She's nice. I feel valued and respected. I feel accepted. She seems to think that we are not hopeless. I'm not to blame. She seems to really understand and accept my side of things. She seems to know what she's doing, right? She's competent. She can help me. I feel a little less pessimistic. I'll try it. Seems okay. Why not? And then the question is, so those are the goals. That's what we want people to be thinking and feeling when they leave our first or second session. Then the issue is, well, what are you as the therapist? What are you going to say or do to make that happen, to create therapeutic alliance? And again, many of these are MDFT ideas. More of them are basic good clinical skills to build the alliance. Well, you're going to begin where the client is at, Therapy 101. You're going to encourage a discussion of the view of the problem from everybody's point of view. You're going to let everybody talk. You're going to listen well to everybody. You're going to say things that demonstrate you really understand the youth, the parents, whoever else is there. You're going to show compassion and empathy. You're going to demonstrate that you like and value the client by praising them and agreeing. Again, teens and parents. We're talking about multiple therapeutic alliance. You're going to be authentic. You're going to offer unwavering support to everybody and to the family as a whole. You're going to be positive. And you're going to identify and amplify and hold still their strengths and competencies. You're going to generously compliment and praise, agree, be respectful, be collaborative. We often say that I'm not the expert on your life and your family. You're the expert on that, but I have knowledge and experience to help you figure out what your problems are and solve them and make life better for you. You're going to discourage feelings of shame, guilt, and blame, which are often common, especially in parents, but often in youth too. You're going to portray confidence in yourself and the treatment program, lend them your optimism, and empower youth and parents, because this is what's necessary to move forward and to be a foundation for behavioral change. And you're just going to have a series of conversations, not only in session 1, but other sessions to create opportunities to build this therapeutic alliance. And it doesn't have to be perfect alliance, but enough to move forward. Now, you think there are some things that therapists can do that can interfere with alliance building. So I'd like to go over those things. What are the things that you're not going to say because they're going to not facilitate therapeutic alliance? Say or do. Well, you're not going to be judgmental. You have judgments. Everybody has judgments, but you're not going to be judgmental in this situation. You're not going to be a know-it-all. Remember I said we're very collaborative. You know things as a therapist, but they know things too. You're not going to be dispassionate. You're going to have passion. You're not going to ask a lot of questions, so it looks more like an interview than a conversation. We want MDFT to be very organic and conversational, even though you have clear goals. You're not going to be the parent police telling parents what's good parenting, what's bad parenting, and so on. It's very individualized. You're not going to take sides. Just doesn't help matters. You're not going to lecture. You're not going to think you're better than the client. You're not going to be distant. You're not going to be a parent to the parents or the youth. And you're not going to be like a teacher, cop, child welfare worker who all have their roles, but it's different than being a therapist. It's really important for us to understand our role. So that's a general idea of how we're going to develop Alliance. I'll give you more details as we go on. But Alliance is number one for foundation, and motivation is the second. And it's motivation to participate in treatment, give this a go, a motivation to examine oneself, a motivation to be open to new ideas. The therapist is going to ask the parent and the youth to try different ways of parenting, different ways of talking to each other. We want them to be motivated and willing to experiment with some of these ideas. And a motivation to consider changing their attitudes and behaviors. Super important. And this is, again, basic to most excellent therapy. Now, how do we create motivation in MDFT? Well, we create motivation by creating an environment where parents and youth feel, don't just talk about, but feel and experience both despair and hope. Those are the keys to motivation, despair and hope, not one without the other. And so what we do is we're going to focus on the distress, despair, and dissatisfaction. We want the youth and the family in session with us to feel that despair and that dissatisfaction. And so we're going to say things to create that environment. We're going to use the current crisis typically to focus on the seriousness of the problem. Sometimes the parents have been in this situation for so long that they're kind of numb to the seriousness. So you sometimes need to bring that into relief for them. We're going to paint a picture of the current unhappiness, typically for everybody in the family. We're going to develop a sense of urgency. I like to use the metaphor, the house is on fire, the ship is sinking, and we all have to do something. And distress is our ally. It's going to facilitate motivation. But distress and despair and unhappiness, the house is on fire, the urgency, that's not enough for motivation, because that would just, you could be paralyzed by your distress. And so the MDFT therapist has a way of creating the distress and despair, and then hope, right? Hope, positive expectations. That's the answer. And so the house is on fire, but I have the hose right here in my hand. I've got the fire truck out there outside on the curb. I've got the fire station down the street. I'm going to help you put out this fire. So you're not alone anymore. And you're going to portray confidence in yourself as a therapist and in the program. You're going to lend them your optimism about not only your program to help them, but their ability to help themselves. You're going to paint a picture of a better future, hope. And then if possible, you're going to look to create an early success in some area. Maybe there's a school meeting tomorrow, or you can talk to the probation officer, or they don't have IDs and you can help them get IDs, or you can get them signed up for food stamps, or you can go to the food bank and bring a bag of groceries, something to show that I'm not just talk, but I'm also action. Now, in the adolescent domain, in stage one, we're developing motivation and alliance. We have some special interventions, which I'll talk about briefly. First, you've got to know what you're dealing with, the adolescent. And here's one cartoon to show that. You know you've got it right when your parents can't look at you without wincing. How are we going to reach this adolescent? Well, in MDFT, we have this phrase called "there is something in this for you." And this is kind of the intervention that we use to get adolescents motivated and engaged in therapy. And that's because most teenagers, they don't want to come to therapy. They're usually coerced. Their parents force them, school, the court, probation, something like that. And they come in usually with a negative attitude, whether or not they've been in counseling before, that we're going to be like their parents, we're going to take their parents' side, we're going to make their life miserable, we're going to have their parents be more strict. Usually they're not coming in with a happy feeling about this. And the MDFT expresses to them in words and deeds that, no, that's not how we work here. There's something in this for you. I want to help you get some of what you want. And you ask the youth to tell you their complaints about their parents, about school, about life in general. And then you start expressing to them, and actually through actions, that you can make it happen. So many of the teens come in and they are upset about their parents. They don't understand me. They treat me like a kid, whatever it is. And there is something in this for you. One of the big ways to move with the child is understanding their complaints and saying, well, that's part of what we can do here. I can help you help your mother understand you better and listen more. And you go through others. And once the child learns that there is something in this for them, or there may be, they're more likely to engage in therapy. And of course, in MDFT, we have specific protocols and interventions to make that happen. And I want to have Deena Corso from Portland Department of Juvenile Justice talk about the focus on the adolescent in MDFT. Okay, so we talk about there is something in this for you as an important intervention for the youth. For the parent in stage 1, we have a few interventions. And I'll go through them briefly. One we want to enhance their feelings of love and connection. Because often by the time we get parents in therapy, they have been through so much. They love their children, of course, but they're just not really feeling it day to day. They may be feeling more of anger and disappointment and hurt more than the love. And so it's very important to get the parents more connected with their love towards their child. Again, we need that in order to, it's the foundation. They need to feel the love, let me put it more simply, in order to do kind of the difficult things that we're going to ask them to do as we move on and we help the parents help their children. And so in MDFT, we have something called the parental reconnection intervention. And it's almost kind of like hypnosis, but not really. And it's great to do in the home because you have props such as photos or trophies, but you can do it in an outpatient basis too. And it's basically you want to go over, look at family photos with the parents. Photos, especially of the child, when they were younger. It could be a baby, Christmas, Halloween, birthday parties, and you sit and you just talk with them like you would talk with anybody about, oh, how cute, and, oh, he always wanted to be Spider-Man, and you laugh and you chat and you talk, and you really try to get the parents kind of back in that time period, what they were thinking and feeling in those early days. And when you feel like you have the parent there, then you pause and you say something like, whoa, I bet you never dreamed then that you would be in this situation now with your son or daughter. And you pause and you let them think. And this usually creates tremendous emotion in the parents of love because, of course, when he was 5 years old and being Spider-Man, they never thought that when he was 15 he would be addicted to drugs and involved in the juvenile justice system. No parent does. And that helps get the parent back connected to the feelings of love that they need to move forward. That's why it's important stage one work. And then if we have other interventions, if that's not enough. And again, some parents, you get them into therapy, they feel they're loved, they're totally connected, then you don't do this. Two other interventions that I want to briefly review are You're the Medicine and No Regrets. And You're the Medicine is basically, again, when parents come in, often they've tried everything, they've had it. And I'm sure many of you who are therapists will hear them say, this has nothing to do with me, it's all him, meet with him, I can't do it anymore. And so, but we need them, and their child needs them, and they need to be needed. And so the intervention with the parents is something like this. You say, look, if I could meet with your child and help him do the things that you want him to do, I would do it without getting you involved. It's my job. I know your stress and your burden, and you have 2 jobs, and I wouldn't do it. But the fact is, you are the medicine, that you're the parent, and even though you may feel you don't have influence, you do, and we have to do it together. And again, most parents will agree and come along. And the final, if you're still struggling to get the parents engaged, and I'm spending time on this because I know many therapists who don't do MDFT struggle with getting parents involved. The final type of intervention that we use is called No Regrets. And that goes something like, I feel very optimistic about you and your child and what could happen. I don't see why, we can't help him get his life back on track. But who knows, right? You never know what will be. But you say, but I know that you don't want to look back. God forbid if something horrible happens, you don't want to look back and have regrets. I should have done this. I wish I had done that. It's horrible to wake up every morning and look in the mirror and have these regrets. So at a minimum, you work with me, you work with this program in these 4 to 6 months. I think we can make great changes, but who knows? At a minimum, I know you can wake up every morning and look yourself in the mirror and say, I have done everything. This gets these 3 interventions, parental reconnection, You Are the Medicine, and No Regrets. This gets at the heart of the parent. It gets at their emotion. It helps them feel the love, and they're going to be willing to work with the MDFT therapist and try and experiment and do all the hard stuff we have to do.